This is Dr. Bev Knox, and you are listening to my Psychology Tutorials, Learn Psychology While You Sleep. People often think of childhood as a carefree and happy time, yet it can also be frightening and upsetting. In fact, children of all cultures typically have at least some emotional and behavioral problems as they encounter new people and new situations. Now let us review Attention Deficit Hyperactivity Disorder. Children with Attention Deficit Hyperactivity Disorder, also known as ADHD, have great difficulty attending to tasks or behave overactively and impulsively, or both. Because all children are inattentive and impulsive to a certain extent, the symptoms must be beyond what is developmentally normal in order to qualify for a diagnosis of ADHD. ADHD often appears before the child starts school. Children who move constantly may find it hard to attend to tasks or show good judgment. In many cases, one of these symptoms stand out as much more than the other. About half of the children with ADHD also have learning or communication problems. Many perform poorly in school, a number have difficulty interacting with other children, and about 80% misbehave, often quite seriously. The children may also have great difficulty controlling their emotions, and some have anxiety or mood problems. Around 7% of all children display ADHD at any given time. As many as 70% of them are boys. Those whose parents have had ADHD are more likely than others to develop it. The disorder usually persists throughout childhood. Many children show a lessening of symptoms as they move into mid-adolescence, but as many as 60% of them, particularly those with more severe symptoms, continue to have ADHD as adults. The symptoms of restlessness and overactivity are not always usually pronounced in adult cases. Adults with ADHD have higher than average rates of substance misuse, risky sexual behavior, driving accidents, and job changes, and they tend to earn a lower income than others. ADHD is a difficult disorder to assess properly. Ideally, the child's behavior should be observed in several environments, such as school, home, and with friends, because the symptoms of hyperactivity and inattentiveness must be present across multiple settings in order for ADHD to be diagnosed. Because children with ADHD often give poor descriptions of their symptoms, it is important to obtain reports of their symptoms from parents and teachers. And finally, although diagnostic interviews, rating scales, and psychological tests can be helpful in the assessment of ADHD, studies suggest that many children receive their diagnoses from pediatricians or family physicians rather than mental health professionals, and that at most 1/3 of such diagnoses are based on psychological or educational testing. Now let us review the causes of ADHD. Most of today's clinicians consider ADHD as a result from several interacting causes. Biological factors have been identified in many cases, with genetic studies suggesting that certain children have a predisposition to display inattention, impulsivity, and overactivity. To appreciate the brain factors that many contribute to ADHD, it is necessary to first understand normal human cognition. There are two complementary processes that make up our moment-to-moment attention. Type 1 attention processes are beyond our voluntary control and focus our attention on unexplained things that occur in our surroundings, such as sudden sounds or startling information. In contrast, Type 2 attention processes are mental activities that we control, and they involve our effortful focus and attention. In order to attend to our environment properly, we must have an appropriate interplay between Type 1 and Type 2 attention processes. The symptoms of poor attention that characterize ADHD are commonly understood as a breakdown in the balance between Type 1 and Type 2 attention processes. Brain scan studies have identified an attention circuit, a number of structures that work together throughout the brain to bring about attention and to maintain a proper balance between Type 1 and Type 2 attention processes. Research on the possible ties between the attention circuit and ADHD is still unfolding, but indications are that individuals with ADHD have a dysfunctional attention circuit marked by poor communication, that is, low interconnectivity between the structures in this circuit, as well as by abnormal activity of the neurotransmitter dopamine throughout the circuit. Given the dysfunctional attention circuit of these individuals, their Type 2 attention processes are, more often than not, simply unable to override their Type 1 attention processes. In addition to biological factors, ADHD has been linked to a high level of stress to family dysfunction. In fact, some studies suggest that these negative factors interfere with the development of effective Type 2 attention processes. In addition, sociocultural theories have noted that ADHD symptoms and a diagnosis of ADHD may themselves create interpersonal problems and produce further symptoms in the child. That is, children who are hyperactive tends to be viewed negatively by their peers and parents, have impaired peer relationships, and in turn come to view themselves negatively. How is ADHD treated? Almost 80% of children and adolescents with ADHD receive treatment. There is, however, disagreement in the field about which kind of treatment is most effective. The most commonly used approaches are drug therapy, cognitive behavioral therapy, or a combination of both. Around 2.2 million children in the United States, 3% of all school-aged children regularly take medication for ADHD. Many clinicians worry about the possibility of long-term effects on those who take these various stimulants. Extensive investigations indicate that ADHD is overdiagnosed in the United States, so many children who are receiving stimulants may in fact have been inaccurately diagnosed. In addition, a number of clinicians and parents have questioned the safety of these stimulants. Cognitive behavioral therapy, particularly interventions that seek to change and/or manage specific behaviors, is often used for individuals with ADHD. In many cases, parents and teachers are taught how to apply the principles of operant conditioning, rewarding the children for attentiveness or self-control. They may, for example, set up a token economy program in which the children receive tokens whenever they attend and respond appropriately. Tokens that can later be exchanged for rewards of various kinds. Parents of children with ADHD may also receive parent management training in which cognitive behavioral techniques are combined with family interventions to help them deal with their children more effectively. Many children with ADHD also participate in summer treatment programs. Typically, these programs take the form of an 8-week therapeutic camp that provides systematic cognitive behavioral interventions in classroom-like formats. Research suggests that children with ADHD may improve most when they receive a combination of stimulant drug therapy and the cognitive behavioral treatments.